Hi, my name is Madeline. I am talking today about Hashimoto's thyroiditis. All of this information I got was from the Mayo Clinic website. So Hashimoto's thyroiditis, some other names for it are chronic lymphocytic thyroiditis or chronic autoimmune thyroiditis. So what it is it's an autoimmune disorder that affects the thyroid gland, which is in your neck. And this means that the immune system is attacking healthy tissue. In this case, immune system cells lead to the death of thyroid's hormone-producing cells, which results in decline in hormone production or hypothyroidism. So some common causes, it is an autoimmune disorder. So the immune system creates antibodies that attack the thyroid cells as if it were a bacteria or a virus or a foreign body. So the immune system is wrongly enlisting disease-fighting agents that damage cells and lead to cell death. The direct cause is unclear, but it could be contributed by genetic factors or environmental factors, sometimes both. Some signs and symptoms of Hashimoto's thyroiditis are fatigue or persistent tiredness, increased sensitivity to cold, increased sleepiness or hypersomnia, dry skin or xeroderma, constipation, muscle aches / tenderness and stiffness, also known as myalgia, joint pain and stiffness, which is also known as arthralgia, irregular or excessive menstrual bleeding, also known as menorrhagia, depression, problems with memory or cognition, that is also called bradyphrenia, swelling of the thyroid or goiter, puffy face or facial edema, brittle nails or onychoschisia, hair loss or alopecia, and enlargement of tongue or macroglossia. And since the thyroid affects all organs or all systems in your body by producing hormones, it's possible there are other symptoms as well. These are just some of the main ones. So how to diagnose Hashimoto's thyroiditis? Often it's by blood tests such as TSH or thyroid stimulating hormone. So a high TSH level indicates hypothyroidism. And then they'll also test T4, which is thyroxine, which is the main thyroid hormone. So a low level of thyroxine or T4 confirms findings from the TSH. So high TSH, low T4. And then additionally, they'll also do antibody tests because it is an autoimmune disorder. So when testing the antibodies, they use this to determine if the Hashimoto's is the cause of hypothyroidism, and they'll test TPO or thyroid peroxidase antibodies to indicate Hashimoto's disease as the cause of hypothyroidism. So for treatments, luckily they have found something that works. It is a synthetic hormone called levothyroxine that they use for thyroid hormone replacement. So the levothyroxine works as thyroxine does, T4, which our body naturally makes. And then it's just a pill you take. And TSH levels will have to regularly be checked through blood work just to make sure and monitor the dosing. Generally, there are no side effects, however, because it is it works like the natural hormone does in your body, as long as everything's in normal range. So that was about Hashimoto's thyroiditis. Thank you for listening.